and weaknesses. Malaysian healthcare has been through arguably the biggest challenge of its entire history in battling the COVID-19 pandemic. Our previous encounters with SARS and MERS-CoV gave us precious experience, but the COVID-19 pandemic truly took Malaysia and the whole world by storm. Hospitals were swarmed as patients fell to the virus. Hospitals were repurposed for COVID-19 patients. Lockdowns and isolative measures were the initial weapons in addition to hygiene and protective clothing. However, the advent of COVID-19 mutations redefined the equation completely. Now, more than a year into the pandemic, we are still battling the COVID-19 variants. However, there is hope on the horizon. With the COVID-19 vaccination program being rolled out all over the country, we hope to reduce the spread of the virus and reduce the burden of our healthcare facilities. We have experienced a paradigm shift in understanding how to best deal with the virus. With the arrival of the Delta variant, we had to redefine our targets from one of achieving herd immunity through vaccination to one of learning to live with the virus. Endemicity and learning how to live with the virus is the way forward. It will require a massive change in the mindset among the population. Mentally, Malaysians will need to rethink almost every facet of our everyday lives. The mental burden in coping with initial waves of the pandemic to one living with it every day is undeniable. Just like how we had learned how to cope with the dengue virus. So we will need to adjust and learn how to live with COVID-19. The 3 Cs, 3 S, and 3 W will continue to be our mantra moving forward into the next phase of the pandemic. Workers who lost their job were forced to adapt to the new norm and pick up new skills. Restaurants were forced to adapt to a strong takeaway culture, and transport and delivery options became critical. The hospitality and tourism industry was crippled with the international lockdown in tourist arrivals and interstate travelling curbs. Social gatherings were restricted and festives became muted stay-at-home affairs. Police personnel, reservists, and the army were called upon to man the streets. Mental fatigue was inevitable. The education sector was not spared. Teachers were forced to improvise and had to embrace online learning. Family structures were under mental strain as many family units had both parents working, and it became difficult for parents to juggle children at home with job stresses. Students were caught up at home and had to similarly adapt to online learning. We must not underestimate the mental stress that has and was placed on our younger students who are now unable to play outside. The impact upon their mental health must not be taken lightly, and the effect may only be seen in years to come. Out of suffering have emerged the strongest soul. The most massive character are seared with scars, says Khalil Gibran. Our frontliners have been unyielding, unflinching, untiring, unafraid, resolute, and ever determined in their singular mission to protect Malaysia and Malaysians from COVID-19. It has been a battle of Thermopylae, where the outnumbered and under-equipped Greeks stood with the Spartans against the magnitude of Persians. Despite the overwhelming odds stacked against them, the Greeks and the Spartans famously fought tooth and nail. We were in a similar situation as well. The only difference is that we are still holding on. But the viral enemy is relentless and will continue to try to infect and spread among us. This is why we must never let our guards down. We must persevere. At this time, I would like to take the opportunity to thank our frontliners. These frontliners exist in every field, in both the public sector and the private sector. In every company, every department, every school, every police, and military station, and indeed every hospital, clinics, and yes, even our GP clinics as well. All of us, every one of us are invariably frontliners in one way or another. However, in every dark cloud, there is always a silver lining. There were and continue to be many positives from our war against the pandemic. Things that we imagined to be impossible were indeed made possible. Vaccination rates above 500,000 vaccine shots being administered daily in Malaysia became a reality. When our backs were up against the wall, our teams were able to cope and to come up with improvisation and solution that brought us more breathing space against the enemy. Hospital like Hospital Sungai Buloh transitioned into full COVID-19 facilities, and many other over the country were similarly repurposed into hybrid hospital like Hospital Kuala Lumpur, Hospital Tengku Ampuan Rahimah, and among others. Hybrid hospitals improvised by redesigning their patient flows and ward operation. Many drug trials in anti-COVID-19 treatments were carried out locally in tandem with the international centers. The armed forces gave a vital contribution to the setting up of field hospitals where needed, which gave a much needed boost to the Ministry of Health. We have persevered thus far and shall continue to persevere. The pandemic has taught us how to look at matters from a different angle and think out of the box. The stronger adoption of IT and online options for meetings and conferences has reduced the need for traveling for many healthcare staff. The implementation of advanced acute internal medicine services in hospitals, including Hospital Tuanku Fauziah Perlis, have shown dramatic benefits in reducing non-COVID-19 medical admissions, which help decongest the medical wards. In addition, the dramatic drop in average length of stay for non-COVID-19 medical inpatients resulted in a reduced rate of nosocomial infections among hospitalized patients and allowed efficient redeployment of manpower and resources to combat COVID-19. We must focus on the non-COVID-19 burden as well. It remains imperative that we do not lose sight of non-communicable diseases. Operating lists and clinic waiting times have invariably become longer with the pandemic, forcing a redeployment of clinical resources. Non-communicable diseases, if not given adequate attention, will result in an equally, if not more, devastating impact over the years to come. Telemedicine has begun to be explored and has shown promising results. Pilot telemedicine projects, including geriatric care in hospitals, Sungai Buloh, and other Klang Valley hospitals, and outpatient COVID-19 monitoring in COVID-19 assessment centers have been successful. Even in Kanga, at the northern corner of Malaysia, heart failure in patients was addressed with the usage of inexpensive smart apps, which allowed remote monitoring of patients' daily weights and other clinical parameters on smartphones, reducing the need for patients to come to hospital and thus decongesting healthcare facilities. These patients also benefited from a reduce of potentially exposed to COVID-19 in our hospitals. More importantly, the patients were empowered in taking care of their health with input delivered by the heart failure apps and real-time remote monitoring and video consultations by doctors. Unsurprisingly, rehospitalization rates in these patients saw a significant drop as well. All these fantastic achievements by our enterprising healthcare frontliners on the home front have made me proud of the innovative responses of Malaysians to this pandemic. Today, the 10th October 2021, is indeed a special day, the World Mental Health Day, and the World Federation of Mental Health theme of mental health in an equal world resonates with me. Despite not having the healthcare facilities and resources of other countries, we continue to punch above our weight. This is in line with the motto of doing more with less. This mindset will help us to stand strong against other obstacles in the future. Mental disorders are among the most common and disabling health conditions worldwide and should therefore be considered as a top global health priority. In 2015, National Health Mobility Survey, Malaysia reported the prevalence of mental health problems as 29.2% among adults aged 16 years and above. The prevalence of mental health problems among adults had shown an increasing trend from 10.7% in 1996 to 29.2% in 2015. The latest national prevalence of depression was 2.3%, accounting for about 500,000 people, and females, those single, from rural areas and lower income groups had higher rates of it. Coal would remain simply coal, but after intense heat and pressure, it is transformed into diamond. Our healthcare frontliners are our proverbial diamonds. Under stress, increased patient loads, and ever-mutating enemy, they continue to hold the front lines secure. Ever ready to be called upon for duty, they persevered against the odds. We cope when all seems lost and continue to cope in the face of deadly viral variant. We soldier on, nevertheless. We continually redeploy manpower and resources across hospitals and states to where they were needed most. It is most reassuring to see now Malaysians band together in the face of adversity. Yet we must not underestimate the importance of mental health simply because it is not overt and apparent like a broken limb or a stroke. We must recognize that it is a silent illness, masquerading underneath and ready to strike with devastating consequences if not addressed. This can be achieved by reaching out to all levels of society by making mental health services more accessible. It is also essential that mental health services are optimized and sufficiently staffed. However, there exists a gap between such a burden and the availability of resources to manage and reduce it. The number of psychiatrists in Malaysia currently stand at around 500, the ratio being roughly 1 psychiatrist per 100,000 people. The recommended WHO ratio is 1 psychiatrist serving a population of 10,000. To effectively balance this disparity, other healthcare professionals will need to be upskilled to assess and manage mental health issues in the community. Malaysia currently has more than 57,000 doctors, of which GPs make up 6,700, serving both the rural and the urban areas. The most efficient way will be to empower our general practitioners and primary care physicians. This remains the focal point in most communities, both urban and rural. Equipping them with adequate knowledge and of updated treatments in psychiatry will stand them in good state in diagnosing mental illnesses in the public early and efficiently. The World Federation of Mental Health team of Mental Health in an Equal World and the World Health Organization team of Mental Health for All. Let's make it a reality, emphasize the importance of empowering primary care physicians and general practitioners in assessing and managing common mental health problems, especially in regions where psychiatric services may be less available. This collaboration today is one of the first few steps in getting this ball rolling. I'm pleased to note that over 300 attendees are comprising general practitioners, primary care physicians, and internal medicine physicians. My congratulations to the organizing co-chair, Dato Sri Dr. Paras Joshi, and Associate Professor Prem Kumar for putting this event together. At this juncture, I would like to thank the Psychiatry Chapter, College of Physicians Malaysia, and the Academy of Family Physicians of Malaysia, plus the Ministry of Health for ensuring that mental health remains addressed and tackled, especially during these pandemic times. I trust that this shall be the start of a productive two-way sharing of knowledge and experiences to ultimately benefit the public at large. With this, I'm honored to officiate the College of Physicians Malaysia and the Academy of Family Physicians of Malaysia World Mental Health Day Training Initiative. With that, ladies and gentlemen, I thank you.
Baik, itu tadi Ucaptama Ketua Pengarah Kesihatan Tan Sri Dr. Noor Hisham Abdullah sempena Hari Kesihatan Mental Sedunia, dan butiran lanjut daripada intipati Ucaptama tersebut akan kami bawakan dalam buletin AWANI di jam-jam yang berikutnya dan juga di aplikasi Astro AWANI.